Hi, this is a video on a guide on how to get started on exercise after your heart surgery. After your heart surgery, your heart will need time to recover. The recovery process starts now while you're in the hospital. During your stay, you'll learn more about your health condition and receive advices on healthy lifestyle. When you return home, you are expected to put your newly gained knowledge into action to begin your home exercise program and return to your daily activities. Subsequently, you're highly encouraged to continue with the outpatient cardiac rehabilitation program, which is a structured group exercise class guided by trained physiotherapists. The exercises are tailored to suit each individual need. For more details, please contact your cardiac case manager. After your heart surgery, lifestyle modification is highly recommended. It is a foundation for good heart health and prevention of future heart events. It is recommended to make the following changes to better manage and minimize your risk of chronic diseases, starting with smoking cessation, which reduces the risk of heart attack by 50%, controlling the blood pressure, blood sugar, and cholesterol with medication, diet, and exercise. For the purpose of this video, we'll focus on the exercise component of lifestyle modification, starting by maintaining an active lifestyle of at least 150 minutes of moderate intensity exercise each week. Before you get started on your home exercise program, the next few slides will go through some precautions to take note of as you return to activity. Depending on your surgery type, here are some advice on caring for your wound site. You may refer to your handout on wound precaution for more details. Avoid heavy load of more than 5 kg. This includes pulling on and pushing heavy items such as door or chair. If you have a medial sternotomy, that is a cut along your breastbone, follow this precaution for 6 to 8 weeks. In the case of a minimally invasive surgery, a cut along your rib cage, follow this precaution for at least 2 weeks. Do inform your doctors or physiotherapists if you experience increasing pain, instability of the sternum, oozing, or discoloration at the wound site. As coughing and sneezing can cause a pulling pain over the wound site, you are encouraged to use a pillow or a chest brace over the wound site in a self-hugging position to brace the area. This helps to reduce the pain as it provides compression and protects the wound site. In addition, during movement where you need to put weight through your arms, keeping your elbows close to your body helps to reduce stress to the operated breastbone. This can be applied to getting in and out of bed. You can start by keeping your arms crossed by hugging a pillow or elbows close to your body, using your legs to roll to the side. Next, sweep both feet over the side of the bed, followed by pushing yourself up using your elbow and hand to reach a seated position. If your surgery involves taking a blood vessel from your leg, follow this guideline to care for your leg wound. Avoid crossing your leg as this may impair blood circulation. Make frequent position change to avoid sitting in one position to promote blood circulation and wound flexibility. Check your wound daily for swelling and elevate them to help reduce the swelling. If the swelling persists or worsens, notify your doctors. If elasticated stocking were prescribed, wear them while awake for at least 2 weeks after discharge to help with the leg swelling. Basic wound healing happens during the first 6 weeks after your operation. Being aware of your posture promotes proper wound healing. Avoid protecting the wound site by adopting a slouch posture, as these lead to a stiff and painful neck. Keeping your upright posture with your neck, shoulder, and back in a straight line. Be aware of your posture when lying, sitting, or walking. You may resume sexual activity once you're able to climb and complete 2 flights of stairs at a go comfortably. This usually takes 2 to 4 weeks unless your doctors instruct differently. Extra caution is required until the breastbone heals. Therefore, adopt a position that does not put weight on the arm or the chest. Example, resting on your back. Here are some activities which are safe for you to perform at the different stages while you're recovering after your discharge. In the first 6 weeks, you may start with some light cooking, washing your dishes, shampoo, and shower yourself. Remember to keep your load less than 5 kg. You can enjoy leisure activity like reading or working on your computer. You are encouraged to start some light walking on the flat ground or start some gentle cycling on the stationary bike. After 6 weeks, approximately 2 months, you may start to perform some heavier housework such as sweeping, vacuuming, ironing, washing, and hanging the clothes. If you enjoy gardening, you may resume the activities, but remember to keep the load less than 10 kg. You may also start walking your dog on the leash. You may travel and start driving your family car once you're cleared by your surgeon. As for exercise, you may restart some light aerobics exercise without weight. At this stage, you may return back to work once approved by your doctors if your job does not require heavy lifting. After 3 months, for housework, you may start scrubbing the floor or heavy gardening like digging. For exercise, you may start jogging or riding a bicycle. Do note that recovery varies from each individual. You're highly advised to seek clearance from your doctor before commencing on any heavy work, vigorous activity, or driving. This includes sports such as swimming, golfing, soccer, or tennis. Weightlifting of more than 10 kg is allowed at this stage.
Now that we understand the precautions, how do we get started on exercise? A typical exercise starts off with warm-up and stretch lasting about 5 to 10 minutes. Adequate warm-up allows gradual change to the heart rate and decreases stress to the heart. Stretching increases flexibility to reduce risk of injury. This is followed by the actual exercise, which can be split into aerobic or resistance exercise. This would normally last for about 30 to 60 minutes. Please note that you should not be lifting more than 5 kg for the first 6 to 8 weeks after your heart surgery. The exercise then ends up with cool down and stretches. Cool down allows your heart rate to gradually decrease and prevent post-exercise soreness. To plan an effective exercise regimen, it is important to first understand the FIGD concept. F. Frequency of exercise. I. Intensity of exercise. T. Time of duration of exercise session. T. Type of exercises, aerobic or resistance exercise. Let's look at walking program and its progression, as walking is the best form of exercise after cardiac surgery. Start walking at your own pace immediately after discharge to home by following the guidelines as shown. You can start off with 5 to 10 minutes of continuous walking at a normal pace. Increase the walking duration by 5 minutes throughout the week. You should be able to achieve half an hour of continuous walking by the end of 6 weeks. Work on increasing the walking duration first before subsequently increasing your walking speed. You may refer to the walking program on your handout for more details. As the exercise gets easier, you can progress the exercise in this order. You can progress the frequency first, then duration, and followed by the speed. Your exercises need to be intense enough to be effective, but not pushing yourself too hard. According to the evidence-based articles, moderate intensity is highly recommended to reduce cardiovascular risks. You should monitor the intensity of the exercises using 3 methods, such as walk-talk test, rate of perceived exertion scale RPE, and heart rate. You should use these 3 methods together. For the walk-talk test, you should be able to talk while exercising, but it should not be easy to the point where you can sing. You should also be able to count to 10 without needing to stop to take a breath more than twice. Secondly, there is a rate of perceived exertion scale, also known as RPE. It is a subjective numerical scale which can be used to rate how easy or difficult you feel during any activity. The scale goes from 6 to 20. A rating of 6 represents no exertion at all. For example, when you're lying in bed or sitting on a chair without doing anything. As the number increases, you should feel the breathing becomes more effortful. A rating of 20, on the other end, represents maximum exertion where you absolutely cannot go further. Ideally, when you're exercising, you should be feeling somewhere within the green zone, score 11 to 13. In this zone, the exercise should feel a little more challenging and tiring. However, it is a comfortable kind of tired and you are able to continue during the exercise. You may refer to the rate of perceived exertion scale on your handout for more details. You can monitor your heart rate during exercise using a finger pulse oximeter or heart rate monitoring watch. Ensure you remove any jewelry or nail polish on your wrist and fingers. Place the device on your wrist or finger and wait for the device to reflect your heart rate. Alternatively, some smartwatches also have the capability to measure your heart rate and record this down. Otherwise, you can also measure your heart rate manually by following the instructions on the video. You can pause the video here to follow the instructions if needed. Now that you know your resting heart rate, for the first 4 to 6 weeks post-surgery, your maximum exercise heart rate should not exceed your resting heart rate plus 20 beats per minute. After 6 weeks, please consult your doctor or physio for the next steps to progressing your exercises. It is important to recognize some dangerous signs which you may experience when exercising. Signs and symptoms of heart attack are chest pain or chest tightness, breathlessness, unable to speak in sentences, dizziness, cold sweat, nausea and vomiting. If you experience at least 2 or more of those symptoms, Stop exercising immediately and seek your doctor's review. If you have diabetes and if you have symptoms of low blood sugar, such as sweating, clammy skin, dizziness or feeling faint, excessive hunger, or fatigue, please do not continue with your exercise. You may refer to signs and symptoms on your handout for more details. Here are some general tips for exercises. Wear appropriate clothes and proper footwear for exercise. Avoid wearing slippers to prevent tripping or falling. Have your meals at least 1.5 hours before exercise. Have medications at least half an hour before exercise. Make sure to drink enough water during exercise. Do not exercise when feeling unwell. Please refer to the general tips for exercises on your handout for more details.